Hello, everyone. I'm Lynn Cremando for YogaUOnline, and I'm here today with Marlysa Sullivan. Marlysa is a physical therapist, yoga teacher, teacher trainer, and assistant professor at the Maryland University School of Integrative Health. She teaches there in both the integrative science and the yoga therapy programs. She's also the co-founder of the Center for Integrative Yoga Studies, where she teaches in a 500-hour program and co-leads a 200-hour training program. She's a frequent presenter at the Omega Institute and Kripalu, and she's also a researcher and a generally brilliant person. So we're excited to have you, Marlysa. Welcome.
Thank you.
So I have a little conundrum, and because you've got a background in science, I want to ask you this. So we're being bombarded all the time on the TV and internet and print with cures, with pills, with devices, with ways to make ourselves more healthy, to get our weight manageable, programs. We don't seem like we're getting better. It doesn't seem to be working. People don't seem like they're living more glorious lives with technology of drugs and devices and all of this sort of science-based medicine. So I'd like your opinion on that. And because I know from your point of view, you're coming from a bridging two worlds. So
what comes to mind when you say that is this idea of pathogenesis and salutogenesis. So pathogenesis is trying to find the solution to a pathology or condition, which, like you said, a lot of these science-based and even like drug-based or surgical-based allopathic treatments are geared towards, like finding the one cause of some kind of virus or some kind of injury and solving that. And it's fabulous at that. It's, you know, save lives and is really important. But a lot of the chronic conditions that we're seeing today aren't simplistic like that. They're very complex, that they're things like diabetes or heart disease or neurodegenerative diseases. They're caused by a complex biopsychosocial, spiritual, and even environmental effects. Like all of those interplay into the experience of illness or disease. So this other perspective that integrative health comes from is salutogenesis. So instead of finding the cause of disease, it's about finding the cause of wellness, finding like what are the contributors to actual wellness and health, and how do I catalyze those? So practices like acupuncture and Chinese medicine and yoga and Ayurveda, that they're more of that salutogenic perspective, meaning they're helping to find how do we help people to alleviate suffering, to catalyze and optimize the contributors to health and build upon those. And that's really that's what yoga is built on, is that perspective.
Okay, so most of us do not have a master's degree in PT and teach at university. So I'm going to repeat what you said and you tell me if I got it right.
Okay.
The first one, which I can't pronounce, so you'll say it for me.
Pathogenesis?
Pathogenesis. So that sounds like you're trying to find the one cause of a specific illness, like say high blood pressure. And then you're coming up with a drug or a treatment that addresses just that one thing. So it does not take into account the rest of the person.
So I would say high blood pressure is not a great example because of that, because it's inherently like blood pressure is about, you know, part of blood pressure is our mental health, our emotional health, our stress, the way we relate to life. But something like polio, like where there's, you know, there's a virus, there's a thing that is causing it that's very specific. That's what the pathogenic perspective is so amazing at.
So the second one which is called
Salutogenesis.
Salutogenesis. As you were describing all the facets, it sounded very yogic to me in terms of, I thought immediately of the koshas.
Yes.
I thought of the gunas.
Yeah.
I thought of all of these yoga concepts.
Yeah.
Am I right?
Yeah, so salutogenesis is like Dr. Ananda talked a lot about yoga being a salutogenic perspective, and the biopsychosocial spiritual model has a lot of parallels with the koshas, you know, just in a very kind of tangible way, that we have the bio, we have annamaya kosha, we have the psychological, we have manomaya kosha, we have spiritual, we have anandamaya kosha. And then we could look at the social domain of health kind of as a combination of the manomaya kosha and the vijnanamaya kosha. And we can look at pranamaya kosha as kind of a bridge between ana and manomaya, or sorry, biopsychological.
So if we could put this then in the context of, so we're talking about illness. And I think in yoga, sometimes we do focus on disease, but really yoga is to promote ease and harmony. And so if we take away the idea that we're talking about curing a condition, but we're also just trying to take care of a whole life.
We're promoting health, we're promoting wellness, we're helping to we're helping the person to identify the causes of suffering along the biopsychosocial spiritual spectrum, and to work with how to experience a sense of well-being. Like you said, it's not about cure, it's not about getting rid of a disease, but it's about helping to experience a level of well-being regardless of what's happening or irrespective of.
So you talk about the biopsychosocial spiritual, and that sounds a little bit to me, again, systems theory if I go to management school, but
yeah.
That interplay really talks to our personality and sort of who we are. And that just sounds incredibly aligned to a practice of yoga, but each of those has its own elements and its own attributes.
Mm-hmm.
So wanting to nurture all of those, correct?
Yeah, and they all relate to one another. So when you work on any one of those layers, you're always working on all of the layers. Like there's a simultaneous effect. And one of the important things that you were saying at the beginning is it's really important to think of yoga as, it's not that, or is it these postures that fix back pain, or is it this meditation technique that is going to help the heart disease? It's not about that. It's about all of the practices being applied synchronistically towards this biopsychosocial spiritual framework of well-being.
So the framework of well-being is that we have sheaths, or we have biosocial, but each of these, the interplay is sort of harmonious, and we're kind of modulating it.
Yeah.
And we're regulating in some ways energetically. For example, if we talk about the prana, of how we pull that together and how we move through our lives. Am I right on that?
Yeah, so, you know, one of the ideas in yoga is this idea of dharma, and dharma is about this living in inner and outer harmony, the way that we begin to align ourselves with right action along all of these koshas, or along the biopsychosocial spiritual, to experience a level of harmony in the way that I interact with my body, my mind, the way that I interact with others, and the way that I interact with life situations.
I have seen you, I don't want to get technical, but I've actually seen you have authored a study, and in the study you talk about top down or bottom up. Can you talk about that just a teeny bit? top down
Yeah,
and bottom up
so
is
that
a
yeah, so that goes along with this idea of using the practices not as a condition specific thing, but as a holistic perspective and a synchronistic perspective. So we have practices in yoga that are a little bit more focused on top down or neurocognitive processes. So for example, if you imagine an image of peace, or you recite a mantra of peace or equanimity, then you're using the focus of your mind to change your physiology. So you're using the mental processes to change the biophysiological processes. So we have practices that are a little bit more geared towards that, like yama and niyama and ethical inquiry, as well as meditation. But then we have practices that really start in the body. And although they start in the body, they have this immediate effect on psychological state, cognitive state, and the more emotional psychological processes. So there's studies like in Laban movement analysis that really show that when we shift body position, it has an effect on our psychological state and our mood state. So through the practice of asana, we can have an effect on our autonomic nervous system, on our mood, on our emotions, the quality of our thinking, our beliefs. So the body becomes a way to shift the mind in bottom up, and in top down, the mind becomes a mechanism to shift the body.
and it sort of doesn't matter which door you've opened, you're still going to get in. And the goal is more of a mind-body relationship.
Yeah, to help bridge that relationship and to help them meet in the middle and create that effect.
How much of the need for all of these programs and pills and weight loss, how much of that do you think is really partly attributed to our lack of mind-body integration?
I don't know how to answer that.
Well, my question is,
yeah.
you know, are we walking around a bunch of disembodied heads just like...
Sometimes, yeah.
So I guess my question is, how much of the of our health has to do with what we're doing, not when we're sick, but when we're healthy and just going through our lives?
Mm-hmm.
And
yeah, we can help promote a lot of health and well-being when we're in healthy states, for sure.
So there's this concept in the Hippocratic approach. I hope my Latin is terrible, so excuse me. You probably know this term now. You'll probably be able to correct me. Vis medicatrix naturae, but it means the healing power of nature.
Mm-hmm.
That I think kind of speaks to the fact that health is all around us, but we don't always open to it.
Mm-hmm.
And to me, that also speaks to the empowered state of feeling that I can be happy, I can be healthy.
Yeah.
And my practice will take me there.
Yeah, what you're saying makes me think of really two streams of research. One is the research on placebo effects, and the idea that the placebo effect actually has real physiological positive effect. So, you know, it's not to talk about placebo is not to discount it. It's actually to say, like, how do we optimize that? If there is this thing that we can catalyze upon and that we can utilize to create these really deep health effects, how do we do that? And I think when the term I use a lot because I do think it's a fine line between talking about being positive and positivity and spiritual bypassing and ignoring what's present, and kind of I've seen a lot in the kind of integrative health world where that goes awry when people start self-blaming when they get sick. Like, you know, if if I'd really trusted myself, right, if I'd been positive
Mhm.
enough, or if I believed strongly enough, I wouldn't have
On
gotten
the right
sick.
essential oil.
Yeah, and it's not true. Like, I think there's some course I talked about where, like physiology just happens, or, things happen. We don't have ultimate control of everything, and that's not what life is about. Um, the term I often use is from Aristotle. It's called eudaimonia, and eudaimonia comes from Aristotle's idea of, the way that he defined it was the living of a purpose-filled life, like when we actualize ourselves to our highest potential and flourishing. And he actually talked about the way to that was to live in alignment with the virtues, like the values. Um, and in research, they have this concept of eudaimonic well-being, which is about connecting to your personal authenticity. It's about self-actualization, being connected to meaning and purpose, living in alignment with your values, and quality social connections. And what they found is that eudaimonic well-being is correlated with very really cool health effects. So like even on our gene activation profile, it affects the inflammation and our immune system. So it decreases inflammation and supports our immune system. It has an effect on all-cause mortality. So regardless of things like diet or physical activity, people who are connected to meaning and purpose live longer. So that we have these kind of esoteric, kind of placebo ideas like meaning and purpose and quality social relationships that are being shown to have real physiological effect, to help prevent or mitigate things like neurodegenerative disorders, heart diseases, cardiovascular diseases. And so, that's part of salutogenesis, is instead of trying to find all the different causes and fix all the little things, we can take a much broader perspective and help people live an improved quality of life. And that does have a real effect down to the inflammatory markers in our immune system. And so helping us to have a real relationship with those ideas, not a false positivity, but a real idea of what it means to experience meaning and purpose.
Meaning and purpose, I love that. I read a study where the control group knew that they were getting a placebo and they still improved.
I mean, it's really cool, right? And there's nothing negative about that. Like, if the placebo effect is this thing that really works, then why not figure out how to help people to experience it?
What I love about what you said about meaning and purpose. I like also the idea of empowerment,
Mm-hmm.
and not, as you said, not fake empowerment, not I'm invincible and I'm not going to get cancer because I am a vegan and I get up at 3:30 and meditate. And no, I have the ability to decide what I'm going to do about what's going on. I feel like that sort of empowerment of, I can't control the situation, but I can control my reaction, goes really along with the meaning and purpose. Because if I'm in alignment with my meaning and purpose, then my decisions about how I'm going to kind of deal with whatever comes is going to be affected.
Yeah.
So even if I'm not well, I still have a lot of choices.
Yeah.
But what are some practices? Like, how would you kind of, meaning and purpose, what does that look like in developing as a practice?
Yeah, I think it is a lot about reflection and things like journaling. So being able to reflect on what is really meaningful to you, what has been meaningful to you in your past, what are the things that you get excited by, what brings you a sense of awe, what brings you a sense of that excitement. Yoga has the concept of the yamas and niyamas, these ethical principles. And a lot of times people talk about the yamas and niyamas from the Yoga Sutras, where there's 10. but in the Bhagavad Gita, there's over 30. So it's really any ethical principle that you want to work with. So having someone, and this is what Aristotle taught about working with ethics and values, was that you would take any value like humility or generosity or kindness, and you would think about, what does this mean to me? What is the excess? What is the deficiency? So anything is on a continuum. So if I think about like humility, and excess of humility is not taking up for myself, where deficiency in humility is being a narcissist. And so if I think about those two ends, and then what does the middle mean to me? How do I relate to that middle? Then we can begin to really, the person can begin to really have a really in-depth contemplation and reflection on any of these qualities. And then what we add to that in yoga is a felt experience of it. So not just cognitively, what does this value mean to me, but how do I experience it? Like when I experience kindness in my body, where do I experience it? How do I experience it? And in yoga, we're teaching people how to feel the blueprint of it, feel the template, so that when they go out in the world, they begin to notice when they go towards either deficiency or the excess, and they can realign. So by doing this really deep body-based exploration of ethical inquiry and values, we align ourselves with the actions that harmonize our body, our mind, and our relationship to life.
That sounds so beautiful. You know, what I thought about when you were talking is, I often talk to my classes, because I work a lot with older people who have a lot of issues, and the self-judgment that comes in, as you were saying, I should have done this, or, you know, I could do this 25 years ago or whatever. And I talk to them about the Travis Wellness Initiative continuum. So here's like horrible, leading to death, chronic illness, here's neutral, and here's going toward wellness. The end of the story is everybody dies at some point, right? But people tend to say, where am I on the continuum? And what I say is, it doesn't matter where you are on the continuum. It only matters what direction you're facing. Mm-hmm. Are you facing this direction, or are you facing this direction? If you are turned and facing this direction, you're on the right path. Yeah. It sounds a lot like what you're talking about there, with the sort of the alignment and the sort of acceptance and cultivation almost of that. I want to say that authenticity, that
yeah. And I think, you know, you were talking about working with people as they get older. You know, it is a really interesting thing in our society to become older and to really appreciate what that means. You know, to understand that there might be a loss in this function or that whatever, but also this society tends to not have that place for the wisdom holder as we get older, and to really begin to like relish and appreciate the experience that we have as we get older is really powerful.
So you're a physical therapist and you're a yoga therapist. So I think of you, and you teach in an integrative health program, but you came out of a traditional Western program, correct? Mm-hmm. So I think of you bridging these two worlds. And what it sounds like you're saying, and I know you're in an integrative health place, but the ancients started out with this whole body system. Then we got very nitsy and gritty. And now with integrative medicine, we're going back toward a whole body system. Do you think that's the trend?
Yeah, and I think that there's several reasons for that. Like one is the pain crisis that, you know, or the opioid crisis, is that's helping people to understand the limit of pharmaceuticals in some diagnoses. Of course, they're totally appropriate sometimes, but that's helped us to understand the limitations of it. And I think in cancer too, so there's a couple in the pain research as well as in the cancer research, that awareness of the limitation of the allopathic perspective has really become apparent. And so it's really helped to give more credence to these more integrative therapies that have a different perspective.
Awesome. So you have a class coming up for YogaU, and it's kind of on this topic, not exactly on this topic.
No, it's completely on it.
No, completely on it. All right. And it's called, yay, How Yoga Heals, How to Access Your Body's Own Medicine Chest. What will you be covering in that class, other than everything we just talked about?
Everything, no, yeah. So we'll talk about this idea of yoga as an integrative health practice and the biopsychosocial spiritual perspective. We're going to be focusing a lot on the social spiritual factors and how that creates a down cascade of effect on the physical and mental health. So looking at that bigger picture and how it affects, all the smaller things. We'll be talking about specific practices in yoga that can help to really facilitate social and spiritual well-being. We'll be talking about spirituality in this language of eudaimonia because it forms a kind of secular spirituality. So when they talk about the research of spirituality, we'll be looking at how that's very similar to what they talk about in eudaimonic well-being and how that's very similar to what's in yoga philosophy. And then using that as a lens. So we'll be talking about this explanatory framework of yoga therapy, how the social spiritual perspective and framework and philosophical context of yoga allows us to understand it as an integrative perspective with really powerful health effects for physical and mental health. And then, of course, specific practices.
I'm a little curious about when you say social spiritual practices. I kind of get spiritual, but I'm not so clear on social.
Yeah, so you should join in. I'm just kidding.
When's your class starting? You have a lot of books behind you. Maybe.
I do. So there's actually two.
Can you break that down a little bit for us and talk about practices that might be suitable?
Yeah, there's two ways to think about social well-being in yoga. One is a very simplistic way that when we go to, and I don't mean simplistic in a negative way or anything, but like in the very tangible, like we go to a group class and we have people around us. So especially when you have a group class that might have the same 8 people that came for like 3 years, they really form a community. And so having that ability for people to share before class and after class. One of my colleagues who teaches yoga for a lot of stroke populations here in Maryland, Kelly Bethel, she always leaves a lot of time for people to really talk before and after class, to share like what's been useful, what's been helpful, what they're doing, so that it forms a community and it forms meaningful relationships. And I know a lot of yoga teachers have that, where they have classes they've taught for years, everyone goes to the coffee shop after. So that's one way. There's actually a really cool study by this woman, Alison Ross, called I'm a Nice Person When I Do Yoga. And it speaks to a little bit of that. The other way is that when we develop or when we reflect on and work on the yamas and niyamas, like non-harming, patience, contentment, when we're really practicing yoga in a deep way, we're taking that beyond the relationship with ourselves and into how we relate with others. So I learned to have more patience with my friends. I learned to have more tolerance for differences amongst my friends. I learned to be present with them when they're having a difficult time and to have equanimity around it so that it doesn't like take my energy or whatever. So we learn how to have greater, deeper quality, meaningful relationships through the practice of those qualities. So those are two ways that we work with social well-being.
Does that now work whether you're going top down or bottom up? If you're going like from the physical, does that still apply?
I think that that is often a limitation in what we do in group yoga classes. I think that because we create experiences of equanimity in our body, we've seen that that doesn't really translate. We've seen, you know, leaders in yoga not be nice people. So I think that it is really the combination of the two, so that we're creating that equanimity within ourselves, or kindness or peacefulness, but then really consciously also beginning to ask, how do I bring this into my relationship with my friends, or my relationship with my coworkers, or whatever. So I think it really is the top down and the bottom up that helps us to experience that.
And the medicine chest aspect of this is you're cultivating, as you said before, the sort of the right relationship, right living, all of those things. That brings all of the, whether we're talking about systems or gunas or whatever we're talking about, into a equanimous balance.
Yeah, and the idea that when we experience eudaimonic well-being and meaning and purpose and quality social relationships, it actually creates physiological change. It affects our inflammatory markers, our immune system, our blood pressure, so that by connecting to these kind of abstract, esoteric concepts and really feeling them in our body, that there are health effects that we're actualizing or creating in our body.
And you're going to break all this down.
Yeah.
For our class.
Very simple.
and you're going to do a few practices, is that right?
Yeah, so it's 2 webinars and then a recorded class. So we recorded the class, and the class includes some journaling, some reflection, some postures, awesome, and some playing with the concepts and movement. So
we'll really get a practical idea of how to put these tools into motion. Yeah, and the first webinar will be a little bit more theoretical. Then you'll have the practice, and then the second webinar will be, you know, really kind of dissecting that practice and thinking about other ways to do it, and hopefully having questions from people. Sounds really interesting. I'm looking forward to it. Thank you so much. I'm going to go get my dictionary. Okay. And look up half of what you said. No, I'm just kidding. It's always great to talk to you because you're someone who's super, super smart, but you're not totally inaccessible. So thank you so much. Thank you. I appreciate getting to be part of this organization and group. Well, we love having you. So thank you, Marlysa, and we'll be looking for your course. Thank you. For YogaU, bye-bye, everybody. Bye.